Story 1. A woman in her 40s came in and told me she was having seizures. I asked how she knew, and she said her right hand would periodically stiffen. There was no loss of consciousness or other symptoms more associated with classic seizures, but I ordered tests anyway. It turns out she had been having multiple focal seizures. Story 2. Not a doctor, but in junior high I had a little cough that just wouldn't go away. My grandmother was convinced it was whooping cough. I felt totally fine. It was just an annoying cough. She made me go to the doctor and told the doctor that she thought I had whooping cough. The doctor informed her that it hadn't been in our area in over 10 years, so she doubted that was the case. My grandma forced her to test me for it anyway. Turned out I was positive and considered patient zero. The whole school basically ended up getting it, and we had to shut down for 2 weeks until it went away. Story 3. Not a doctor, but my aunt and uncle had a border collie that would bury his nose in my uncle's back when he was sitting on the couch or recliner. He would walk up, sniff, and keep sniffing until my uncle would shoo him away. A bit later, he would come back, sniff again, and just stare at my uncle. A few weeks later, my aunt was watching one of the local news channels, and they featured a dog that could smell Parkinson's, and she jokingly told my uncle about it. He mentioned their dog constantly sniffing one spot and one spot only on his back, so he went to a high school friend who was a doctor in dermatology. He said it didn't look right and did a biopsy on it. Sure enough, he had skin cancer, but they caught it early and all he ended up with was a scar on his back. Story 4. This is why I usually ask patients what they think is going on or if there is anything they are specifically worried about. Either I get a good idea, or I can figure out a way to make them feel better about their concern. Story 5. Patient here. I told my family doctor, whom I had seen since I was a child and who worked with and saw both my parents as patients for years, that I thought I had reactive hypoglycemia. He scoffed. You don't have that. Why would you think you have that? I told him my symptoms. He was doubtful but told the nurse to get me a Coca-Cola and made me drink it. He sent me to roam around the hospital for a little bit, then get blood work and come back. I came back, and his first words were, "This is so aggravating. Does that mean I have it?" Yes, that means you have it. Story 6. I'm a patient. I had a super painful skin infection on my face and neck that my dermatologist insisted was just an eczema flare-up. She prescribed topical steroids. They help in the short term, but I continued having painful rashes on my face. I asked if it could be a fungal rash, but the dermatologist said she was sure it was eczema. Unfortunately, steroids weaken your immune system, thin your skin, and facilitate the spreading of any infection. A few months later, my hands and fingernails became really painful. Life was hard because I was in pain when I tried to do normal things like write, type, open things, and so on. Eventually, I started getting bleeding blisters on my hands, and my actual nails turned yellow. I saw the dermatologist because at this point I realized topical antifungals gave me some relief, but I needed oral antifungals to treat the actual nails. The dermatologist insisted this was eczema dyshidrosis. I asked for a culture to be taken, and she took a swab, not a nail clipping, which is needed to diagnose fungal infections of the nails. So the diagnostic test, of course, came back negative. She prescribed steroids again, but I was hesitant to use them because at this point I did not trust my dermatologist at all. I saw my primary care physician and explained the situation. He agreed to try oral terbinafine, and it worked. My nails fell out and grew back in, and the infection cleared up. The rashes on my face cleared up too. I was on the antifungal for 7 months. I had a follow-up with the dermatologist and showed her how the antifungals actually worked and that she was wrong. Story 7. I work as a medical laboratory technician. We had a patient who came in insisting that her neighbor was poisoning her. Everyone dismissed her, assuming she had some kind of paranoid psychosis. She remained in the emergency room on a psychiatric evaluation. I ran all the standard laboratory tests on her, and they were normal, but this patient would not budge. She was admitted to psychiatry on a hold. At this point, one of the hospitalists decided why not and ordered tests for several heavy metals and ethylene glycol. Her ethylene glycol level was 32. I don't know if she was legitimately being poisoned by her neighbor or if it was self-induced. But that patient taught me a very important lesson that day. Story 8. I am a nurse, but I just had a patient who came in for a colonoscopy due to constipation and pain with bowel movements. He told me prior to the test he felt like there was something catching on the left side of his abdomen when he had a bowel movement, and he thought maybe I have a big polyp there or something. Sure enough, he ended up having a 2.5 centimeter polyp that we removed from that exact area. I will never get to find out if that catching sensation ever went away for him, but I thought it was interesting that he was right. Story 9. One of my dearest friends from middle school was suffering from absolutely devastating medical issues. She went from bright and thriving in university to having to drop out before she graduated because her health bottomed out. She lost her job that paid her a fantastic amount, and basically her entire life fell apart. She was telling me about the new strange thing happening with her. Some strange anemia that was found to be the result of abnormally low ferritin in her blood, which is what enables your red blood cells to carry iron. That was when something clicked in my brain. Horrible digestive issues, peculiar anemia, chronic infections in her spleen that required a splenectomy, with sunburn to a blistering point in less than a half hour, a diagnosed allergy to sulfa drugs, horrible reactions to carbamazepine. Retinol gave her a skin rash. I'm a pre-med dropout, and one of the first classes I took on my path to pre-med was an undergraduate course in rare conditions and diseases. And one of the ones we discussed in our inherited disorders segment of the class was porphyria. There's an easy way to tell if someone has porphyria. Have them urinate into a clear plastic or glass cup and expose it to direct sunlight. In a period of hours to days, the urine of people with porphyria will turn from clear or yellow to a wine red or wine purple. So I asked her if she trusted me enough to do something weird, told her to get a clear plastic disposable cup from her kitchen, urinate in it, and put it in her windowsill where nobody could see it. And if anything about it changed, come tell me. Approximately 4 hours later, she called me on the phone screaming that her urine turned purple-red like a vampire, and I told her she needed to go to the doctor and get tested for porphyria. 2 weeks later, she tagged me on social media calling me lesbian Dr. House, because she was diagnosed with congenital erythropoietic porphyria. Story 10. I knew my partner had leukemia about a week before I could convince him to go to the doctor. He was bleeding and bruising really easily and had petechiae. I wanted to go to urgent care where I knew the complete blood count was done quickly on site, but he instead wanted to wait to go to his primary care physician. I took him to his primary care physician and had a bag packed for the hospital in the trunk. The doctor told him it was likely a vitamin B12 deficiency, but that he would do blood work to put my mind at ease anyway. I asked if the complete blood count was done on site or not, and he said it was sent out. I asked if he planned to rush the complete blood count. He got very angry and said, "There is nothing the complete blood count could show that would change my treatment plan." Then he told my partner he needed to stop me from searching online. We got a call that night from the lab that his white blood cells were dangerously high and platelets were dangerously low, and I had to immediately take him to the emergency room. I did, and he was diagnosed with acute leukemia. Story 11. Had a patient who came into the emergency department with vague mild abdominal pain whose friend recently died of colon cancer. She was convinced she must have it too. Told her cancer wasn't contagious like that, but ordered a computed tomography scan because she was so insistent in order to reassure her. Lo and behold, she had a huge colon mass. Very bizarre case. Story 12. Emergency medicine and intensive care unit doctor here with over 10 years of experience. While it's not quite a diagnosis, experience has taught me to take it very seriously when a patient states he's about to die, even if he appears in a stable or controlled condition. Patients who have a life-threatening condition usually have a premonition about their imminent decompensation, which is usually preceded by very subtle signs of worsening that may be confounded with pretty much anything that happens in a resuscitation room or in the back of an ambulance. I've had patients who appeared to be in a completely stable condition, with acute conditions where cardiac arrest was not foreseeable, such as a motorcycle accident with a single limb injury, who briefly mentioned they think they are about to die before suddenly entering cardiac arrest due to a malignant arrhythmia. It's believed that patients may perceive a sudden drop in blood pressure or the usual release and spike of adrenaline and other catecholamines as imminent death. But the reason why this happens is not clear. Some we are able to return, others we lose or recover them to a state where death would be better. Story 13. Had a patient come into the emergency department and told me he had epiglottitis, an uncommon infection of the epiglottis, part of your throat. When I went to see him, I asked how he knew. He had had it before but was also a 90-year-old retired emergency department doctor. He was right. Story 14, patient, but I ran cross-country in college during my senior year. My thigh ached, and I told everyone something was wrong with my bone while being told it was a muscle issue. After being treated for every muscle issue possible, I demanded an X-ray. I had a stress fracture more than halfway through my femur. Story 15. I'm not a doctor, but this is what happened when my son self-diagnosed correctly. 3 years ago, he developed a terrible earache and went to urgent care, where they told him he had an ear infection and gave him an antibiotic. The pain intensified over the next day or so he returned and was told he should make an appointment with an ear, nose, and throat specialist, but because it was the weekend, no offices were open, so he had to wait until Monday. In the meantime, his ear started draining and he saw what looked like spores in the fluid, which would indicate a fungal infection. He's a naturalist and knows what spores look like. The pain grew so intense that he ended up going to the emergency room. He told the doctor who examined him that he had seen spores in the drainage from his ear and suspected that he had a fungal infection. He later heard the doctor talking to a nurse in the hallway, laughing and saying, "He thinks he saw spores." The doctor prescribed another antibiotic and a steroid. The next day, he flew home to see us for Thanksgiving. I don't know how he managed the flight because as soon as he got here, he curled up on the floor, howling in pain. I immediately called ear, nose, and throat offices all over town, but most were closed for Thanksgiving week or said they could not see him. Finally, one scheduler took pity on him and said she would move things around to get him in. A physician assistant examined him and confirmed that it was a fungal infection. She told him that the steroid he had been prescribed by the emergency room doctor was the same agent used in the laboratory to culture fungal infections. His infection had started to enter the eardrum and from there could have spread to his brain and killed him. She gave him a prescription that cleared up the infection very quickly. The wrong diagnoses at urgent care and the emergency room cost him over $1,500 out of pocket and several days of excruciating pain. The ear, nose, and throat office did not take his insurance but charged him only $250 for the correct diagnosis. Story 16. Not a doctor, and I do not play one on television, but I nearly became a doctor half a lifetime ago. I diagnosed my husband's brain tumor, leading to emergency surgery. A month in and out of the emergency room with personality changes, he could not stay awake, was diagnosed with a vitamin B12 deficiency, dehydration, frequent vomiting, and vision that looked strange. He could never explain it, but it turned out his peripheral vision was gone, and he had a swollen optic nerve, probably just high blood pressure, according to ophthalmology. After a weekend where I could barely wake him up, he went back to the emergency room, where he waited 4 hours in the waiting room. I asked him if anyone had done a computed tomography or magnetic resonance imaging scan of his brain, just throwing ideas at the wall to see if anything stuck, and I assumed they had not. I told him to insist on a computed tomography scan because I had a wild, sneaking suspicion. 2 hours after being called back, he was in an ambulance on his way to a different hospital with a neurointensive care unit to get scheduled for emergency brain surgery. Massive tumor with dangerous obstructive hydrocephalus. Story 17. When I was pregnant, I was hospitalized overnight due to one of my routine labs being abnormal. Along with high blood pressure, my liver enzymes were extremely high, but everything else came back normal. I spent the night researching my labs and symptoms and asked my nurse if it could be hemolysis, elevated liver enzymes, low platelet count syndrome, which is a very rare form of preeclampsia that can cause your liver to bleed and can kill both you and your baby if left unchecked for too long. The only cure or treatment is to deliver. She literally laughed at me and said there was no way I had it because I would have been in more pain. 2 weeks later, I had an emergency induction due to hemolysis, elevated liver enzymes, low platelet count syndrome. Thankfully, we are both okay. But I will never get over her being so dismissive about something that easily could have killed us. Story 18. My story is just a long and dumb story. I kept getting migraines more and more often. I started getting nosebleeds and blacking out at the gym. One day after the gym, the migraine never stopped, so I went to my doctor, who gave me a Toradol shot. That didn't work, so he sent me to the emergency room. Emergency room? It's sinusitis. Go buy a humidifier. I did. The migraine didn't go away, and I could hear my heartbeat too, so I made an appointment with an ear, nose, and throat specialist. They ordered a magnetic resonance imaging scan, and when they saw the results, they told me to see a neurologist as soon as possible. They couldn't help me see one, couldn't write a referral or anything, but I needed one as soon as humanly possible. So I called my general practitioner. They sent referrals to every neurologist in my area. I called 13 offices, made 13 appointments, and got put on 13 wait lists. I saw a neurologist 2 days later, then called the other 12 back to cancel. The neurologist said, the magnetic resonance imaging scan shows signs you might have too much cerebrospinal fluid in your brain, but magnetic resonance imaging scans don't actually see cerebrospinal fluid, so all we can see are the side effects like the thinning of the bone from the pressure wearing away at it. Your pituitary gland is flattened, etc. We need to do a magnetic resonance phonography scan and a lumbar puncture to see what's actually happening with the cerebrospinal fluid. So we do that, and the pressure in my head is 40 when it should be 5 to 15. Cool. She puts me on medications to lower my cerebrospinal fluid production. Okay. The pain does not change. She doesn't know why. So, this neurologist, because I was just trying to see any neurologist, was a sleep specialist. I decided to change to a headache specialist for more specialized care. He changes the types of medications I'm on, but the pain is basically still agony. I ask him, hey, so I read birth control can trigger this. Should I take my intrauterine device out? He's like, no, you should leave it in. It's stabilizing your hormones, so your periods don't make things worse. I listen to him for a few months, then decide to have it removed. The pain dropped significantly within 3 days of removal. Then I'm like, what is going on? My ability to think clearly is not great, but I pull up my magnetic resonance imaging and magnetic resonance phonography reports and start reading them and doing research on what it all means. Transverse sinus stenosis. A cerebrospinal fluid vein was collapsed inside my head. So I went to my neurologist and said, hey, isn't this important? Shouldn't we have to fix this? No, ignore that. So then I went to see a neuro-ophthalmologist. He was like, your eyes are fine, so your brain is fine. What you're feeling is a migraine. The medications are working. Go back to the neurologist. I was like, what is going on? So I went to a different neurologist. I want a stent. Neurologist? Looks up things on computer. Oh, you do have a stenosis. I'm not really a vein doctor. You need a stroke specialist. Let me refer you. Stroke specialist. Magnetic resonance phonography scans are not great at showing how bad a stenosis is. You need a neurosurgeon to go in there and take a look at it. Neurosurgeon. Yeah, let's go take a look. So the neurosurgeon did an angiogram, exploratory surgery, and saw that the pressure in my head was still 40 after 2 years on the highest dosage of pressure-lowering medication, and I qualified for a stent to fix the vein. I was right. The pile of my previous doctors was wrong. I had to keep changing doctors and believe that the vein was the issue, and all my doctors were mistaken until I finally got help. There's more dumb stuff that happened over the last 5 years, but that's the major stuff.